Are you afraid that type 2 diabetes is irreversible? Feel as if you have to change your entire life to accommodate such a health condition? While a firm cure for type 2 diabetes does not currently exist, it is one of the fewest conditions that can be reversed. Most often, the reversal involves making dietary changes, losing weight, and compromising on foods that are frowned upon. After some investigation, we stumbled upon a supplement allegedly founded on a Hindu medical manuscript's principles. Consequently, 3 particular enemies of type 2 diabetes were revealed. Want in on the details? The purpose of this review is to cover bloodsugarblaster from the inside and out. What is bloodsugarblaster? Bloodsugarblaster is a dietary supplement that aims to support individuals to reverse type 2 diabetes. Developed by Dr. Carter and manager at a medical and research laboratory, Dan Pullman, this respective solution is believed to improve insulin sensitivity. The more sensitivity, the higher the chances of body cells to respond to glucose presence, increase fat loss, revamp certain organ functions and enzymes in the body, and flush away years of high glucose damaged forever. This notion of healing forever is a strong claim. To see where such confidence is coming from, individuals need to appreciate bloodsugarblaster's foundation, the foundation of bloodsugarblaster. Earlier, we introduced a Hindu medical manuscript that might help to reverse type 2 diabetes. Dated as far back as 600 BC, this manuscript is trusted to hold the secrets followed by the king and doctor at the time, Sushruta. Due to mistranslations, the supposed cure went unnoticed up until very recently. It has been reasoned that Sushruta identified 3 culprits, and in crushing them, individuals will naturally treat type 2 diabetes. In fact, his practice is what led Vitality Nutrition to support Dr. Carter and Dan Pullman's efforts in bringing bloodsugarblaster to the general public. How does bloodsugarblaster work? By now, it should be crystal clear that bloodsugarblaster aims to put an end to 3 invisible enemies of type 2 diabetes, which include overacting lipids that hijack the pancreas, fatty liver, and low beta cell production. 1. Overacting lipids hijacking the pancreas. To grasp the concept of lipids attacking the pancreas, we came across a source that referenced pancreas specialist Praveen Chahal, MD. In it, the expert explained that the pancreas is responsible for processing fat. The more fat individuals consume, the harder it gets for the pancreas to process them, forcing it to work too hard. This leads to something called pancreatitis, or inflamed pancreas. As a result, the pancreas fails to produce sufficient digestive enzymes essential for nutrients absorption. Moreover, the organ is highly unlikely to produce the necessary insulin hormone responsible for regulating blood sugar levels. 2. Fatty liver. Fatty liver disease is when excess fat in the liver, which, like above, forces the liver to work harder than it needs. To our surprise, a link has been established between fatty liver and type 2 diabetes. Specifically, a 2011 study was able to find that people who had a fatty liver were significantly more likely to develop the disease within 5 years than those with healthy livers. Other risk factors combined with a fatty liver, such as obesity and insulin resistance, can determine whether one might develop type 2 diabetes. 3. Low beta cell production. Found in the pancreas, beta cells produce, store, and release the insulin hormone, writes diabetes.co.uk. In people with type 2 diabetes, beta cells are incapable of producing a sufficient amount of insulin, hence failing to control blood sugar levels. Aside from its role in secreting insulin, beta cells also secrete the amylin hormone and C-peptide, both of which slows the rate of glucose entering the bloodstream and helps to prevent neuropathy and other vascular complications by assisting in the repair of the muscular layers of the arteries, respectively. Ultimately, bloodsugarblaster appears to work by limiting fat presence so that both the pancreas and the liver can do their task jobs, possibly normalizing blood sugar levels. Also, all damages incurred and future protection is said to be delivered through each serving. Given the general idea of how bloodsugarblaster works, let's turn our attention to the ingredients list. What's inside bloodsugarblaster? The bloodsugarblaster formula is quite wide-ranging as it contains 20 ingredients in the form of plants, herbs, vitamins, and / or minerals. To better understand the extent to which each component can promote healthy blood sugar levels, provided below is an overview of the ingredients list, starting with the main ingredients and followed by the vitamins and minerals blend. Banaba Leaf 25 mg. Banaba leaf is a plant classified under the Lygerstromia species. Historically, alternative medicine practitioners have considered it to treat diarrhea, patients with high cholesterol, and diabetes, to name a few. Regarding diabetes, it has been explained that Banaba contains carboxylic acid, which might exhibit hypoglycemic effects, i.e., improving insulin sensitivity, increased glucose uptake, etc. It contains L-arginins, a type of antioxidant with a high alpha amylase level, i.e., an enzyme that converts complex carbohydrates to simple sugars. Guggul 50 mg. Botanically known as mucol myrrh or Commiphora mucol, Guggul is a small tree that grows across India. Its resin is what cut into alternative medicine, namely by followers of Vedic medicine. According to Peace Health, this respective ingredient has been studied about its effect on high triglycerides, i.e. clinical trials suggest Guggul might reduce high triglyceride levels, acne vulgaris, i.e. helpful in treating cystic acne, high cholesterol, i.e. lowering LDL and increasing HDL, and osteoarthritis. Only one study has been conducted thus far. Bitter melon 50 mg. Bitter melon is a vegetable that resembles a cucumber, but is spiky and bitter in nature. Considered a staple in Indian and Asian cuisine, many Ayurvedic followers insist that it can reduce blood sugar levels. One review noted that bitter melon might help activate AMP, a component responsible for supplying energy throughout the body on demand, in terms of the effect of AMP on the liver. Another review explicitly stated that it could lead to enhanced fatty acid oxidation and decreased production of glucose, cholesterol, and triglycerides. Licorice root extract 50 mg. Licorice root is a flowering plant whose root is known for its sweetness. At the time of writing, it has been shown to some extent that licorice can protect rats with diabetic nephropathy, a kidney-related condition that arises from type 1 and 2 diabetes. The reason for its positive effects might have to do with its antioxidant, anti-inflammatory, and hyperglycemic properties. However, its effectiveness might depend on the type of licorice consumed, i.e., glycyrrhizinated versus glycyrrhizinated. Cinnamon bark powder 50 mg. According to the American Diabetes Association, ADA, cinnamon is a spice that goes beyond flavoring dishes and beverages. Health-wise, its effects have supposedly led to improved blood sugar levels, healthy HDL levels, lowered LDL levels, and balanced triglycerides. The latter results stem from a study that involved the intake of different cinnamon concentrations, all of which, minimum 1 g and maximum 6 g, help to manage blood sugar levels better. Gymnema sylvester leaf powder 50 mg. Gymnema sylvester is a plant that grows in tropical forests in India. Its leaves have since been incorporated in medicinal preparations and have garnered the title Destroyer of Sugar. This leads us to blood sugar, and according to the claims made, both type 1 and 2 diabetes have been treated in India using this plant for over 2,000 years. Studies have concluded that it might help normalize blood sugar among type 1 diabetes patients and help stimulate the pancreas to produce insulin in type 2 diabetes patients. Yarrow flowers powder 25 mg. Belonging to the Asteraceae species of flowers, yarrow contains inulin, a prebiotic fiber, which might help maintain normal blood sugar levels. Depending on the type of inulin consumed, one can anticipate decreased fat in the liver, and a reduction in fasting blood sugar and a hemoglobin A1C, a marker for long-term blood sugar control. Other benefits have been reported to include improved nutrients absorption, bone density, and colon and digestive health. Cayenne pepper powder 10 mg. Cayenne pepper is liked for its rich source of capsaicin. One study found that capsaicin reduced the blood glucose levels of diabetic rats by increasing insulin and glycogen levels better than capsaicin. In a review that assessed its effect on metabolic syndrome, it was uncovered that capsaicin might be able to increase fat oxidation, improve insulin sensitivity, decrease body fat, and improve heart and liver function. Juniper berry powder 25 mg. Juniper berries carry anti-inflammatory and antioxidant effects, which might help to support heart health. Unfortunately, studies that examine its effects on blood glucose levels are not as common. In fact, it appears to have scientific evidence that is somewhat obsolete. Nonetheless, researchers of one particular study were able to find that within 24 days, rats that were administered juniper berry extracts experienced a drop in blood sugar levels. White mulberry leaf powder, 25 mg. White mulberry is an herb whose leaves are powdered for medicinal purposes. One study investigating the effects of white mulberry leaf tea on rats with type 2 diabetes reported some changes in the first 2 weeks. However, after 4 weeks, there was no significant improvement in polyphagia, body weight gain, blood glucose, glucose tolerance, serum insulin, etc. The researchers appear to side with its hypolipidemic, i.e., reduces lipid levels in the blood, effects rather than its proposed antidiabetic effects. Vanadium, 200 mcg. Vanadium is a type of compound that hasn't been given enough thought regarding its ability to reverse type 2 diabetes. WebMD shared that only early studies exist, where some evidence on its ability to normalize blood sugar levels in animals with type 1 and 2 diabetes was reported. Interestingly, when human subjects were given this ingredient, there was only a modest increase in insulin sensitivity. Alpha-lipoic acid, 30 mg. Alpha-lipoic acid, ALA, is a sulfur-containing compound that is naturally found in human cells. Without it, energy production within the mitochondria will have halted. Regarding its benefits, some studies were able to show that it might improve blood vessel circulation to the nerves, may act as a treatment for diabetic peripheral neuropathy, and is trusted to increase insulin sensitivity and reduce both blood sugar and lipid levels triggered by oxidative stress and inflammation. L-taurine, 25 mg. L-taurine is an amino acid, i.e., the building block for protein, responsible for absorbing fats and fat-soluble vitamins. Its contributions toward regulated blood sugar levels are trusted to expand blood vessel function, which is an essential step towards insulin secretion in people with type 2 diabetes. Supporting vitamins and or minerals per serving have been summarized as follows. Vitamin C, 50 mg. Potential to offset the effects of free radical damage on blood sugar levels. Vitamin E, 15 U. Trusted to improve insulin activity and might even reduce oxidative stress-induced hikes in blood sugar. Biotin, 300 mcg, is poised to benefit diagnosed diabetics by regulating blood sugar levels. Magnesium, 125 mg. A deficiency in magnesium has been linked to increased blood sugar fluctuations. Zinc, 7.5 mg. Might trigger insulin production essential for overseeing glucose activity. Manganese, 1 mg. A deficiency in manganese might give rise to glucose intolerance. Chromium, 67 mcg. Can increase insulin sensitivity. Bloodsugar-blaster is a diabetes supplement formulated as a permanent solution for type 2 diabetes. The makers of Bloodsugar-blaster claim a woman completely eliminated all diabetes symptoms after taking the formula. That woman lowered her blood sugar from 512 to 130 while losing 22 pounds. That woman stopped taking her prescribed medication and no longer has any symptoms of diabetes after taking Bloodsugar-blaster.